This week's Ask Dr. Durie comes from a patient who wants to know, why is it that some doctors will wait and watch when the myeloma protein level or the free light chain changes, versus other doctors who, when they see a small change or a jump in the M spike or light chain level, will decide to jump in with new treatment? And so this is obviously an extremely important question that comes up a lot for patients with their ongoing monitoring and testing. And so the first point is that when the M spike, the myeloma protein level, goes up a little bit, or the light chain ratio goes up a little bit, a change of 25% in the M spike, at least 500 milligrams or 0.5 grams per deciliter on the level of the spike, when that happens, this is what is called biochemical relapse. But that does not mean that a patient may actually be experiencing the effects of an actual relapse. There may not be any new bone lesions, there may be no new anemia or kidney problems or other aspects of progression of the myeloma. And so it is quite important to take some time to recheck the myeloma protein levels, to double check and monitor for at least a month or two and just see what is going on. And it is important to realize that sometimes this biochemical relapse may be the only thing that happens, and that this slight increase in the protein level may be something that persists, in other words, remains somewhat stable at that level, or it may increase slowly over time, sometimes months, sometimes even as long as several years. And so it is really important to create a baseline, to monitor for a few months and just see what is the pattern of this change in the myeloma protein level before jumping in quickly with some alternate therapy, particularly if no signs of active myeloma are determined on additional testing. On the other hand, it is important to discuss this carefully with your doctor and to be aware that sometimes, as the questioner mentioned, sometimes the doctor may say, well, look, I'm quite concerned about this. We maybe do need to jump in with some new therapy. And this is mostly in a patient where there is more high-risk disease, where the doctor is concerned that given a little bit of time, there will indeed be a lot more problems coming from the myeloma, and it may be appropriate to jump in quickly. And so the bottom line in this question is biochemical relapse is always very important and something that does need to be discussed with the doctor. Many times it's possible to watch for a while, sometimes for quite a while, but on the other hand, it may be that it is necessary to jump in with early treatment.